welcome to Medical Dialogues. I'm Roshni Dal. Let's look at today's top news. NMC initiates online survey on mental health. The National Medical Commission has initiated an extensive online survey conducted by its National Task Force focusing on the mental health and well-being of medical students. Medical colleges have been urged to participate with responses due by 3rd of May. Assurances of confidentiality have been provided, emphasizing that participant identities will remain confidential and solely used for analysis and recommendations. The survey, facilitated through a Google form, underscores the importance of data security, acknowledging the inherent risk associated with online transmission. Participants, including UG, PG students, faculty, and administrators, are required to furnish personal details. UG medical students are tasked with providing comprehensive information ranging from academic workload to family dynamics and financial stressors. Questions delve into areas such as exam pressures, academic performance, and experiences with social isolation. Bengaluru Radiologist assaulted, robbed of ₹50 lakh gold cash at gunpoint. In a shocking incident, a radiologist residence in North Bengaluru turned into the scene of a significant robbery. 3 assailants suspected to be gangsters from UP executed a meticulously planned heist. The radiologist returning home after work was confronted by a masked intruder in his hall. Despite his resistance, he was overpowered, assaulted, and threatened at gunpoint along with 2 accomplices. The miscreants made off with 500 grams of gold ornaments valued at ₹30 lakh, ₹20 lakh in cash, and 6 wristwatches. They had been lurking near the doctor's house in a car strategically positioned about 50 meters away. The robbers have observed the routines of the doctor's family members. Struck with the doctor's wife and daughter had left the house. Risk in diabetes, forced to go for amputations due to foot ulcers, CMC Vellore study. A recent study conducted by the Christian Medical College Vellore has uncovered a concerning trend among diabetes patients in India, a rising number of toe and foot amputations due to diabetes-related sores. Published in the peer-reviewed journal Science Direct, the study reveals that the risk of subsequent amputations triples after the first procedure, underscoring the severity of the issue. In India, diabetic foot ulcers or DFU tend to present as larger wounds compared to global standards, leading to higher rates of amputation. The study, led by the Department of Endocrinology, Diabetes and Metabolism at Christian Medical College Vellore, found that over a 10-year period, mortality rates among patients with DFU range between 25 to 30%, with heart-related issues and sepsis infections being the primary cause of death. The NCDRC recently affirmed the Delhi State Consumer Court's decision holding Safdarjung Hospital and 2 cardiologists accountable for medical negligence. The hospital and doctors were directed to compensate the patient's wife with ₹25 lakh following the patient's demise during treatment. The NCDRC upheld the State Consumer Court ruling, emphasizing that the administration of injection Nirman was essential as per medical protocol, yet it was unavailable at the hospital. Consequently, the court deemed this as a lapse in care, and the hospital failed to provide evidence that the alternative injection albumin was a prescribed substitute. Additionally, the absence of mandated medical records further weakened the hospital's defense. The case stemmed from the admission of a patient with multiple health issues, including COPD and cardiomyopathy, who ultimately succumbed to cardiac arrest. Despite the hospital's assertions regarding the patient's complex medical condition, the lack of supporting medical records raised doubts about the treatment's appropriateness. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.